Thank you for tuning in to PhillyCAM Voices. Illegal dumping in Philadelphia. Does poverty play a role in the practice? We'll take a look. Mothers cry out and say their children are being taken out of Philadelphia homes more than in other cities. We'll explain why they protest in front of the Department of Human Services. Getting the COVID-19 vaccine. We have an interview with Daphne Owen, who talks about what to expect. And saving a furry friend, how to adopt, is skyrocketing. Thank you for tuning in to PhillyCAM Voices. I'm your host, Amanda Johnson. Are poor neighborhoods more likely to be the victims of illegal dumping? As Melania Alonso explains, this answer is yes.
For years, Philadelphia has been known as one of the largest and oldest cities in America, but recently it has been recognized for another reason.
To know that Forbes rated us the dirtiest city in America, I took it extremely personal.
Terrell Hagler is a sanitation worker who thinks the city's trash problem is more complex than people might think.
The way garbage collection ties into poverty is because we, as a city, we just tend to care less about those neighborhoods. A block gets missed, and a cleaner neighborhood, you have 6, 7, 10 neighbors calling 311 in the sanitation department saying that our block wasn't picked up. Versus Kensington, where if a block gets missed, it's, oh, they do this all the time, we don't care, and then it starts to pile up.
Illegal dumping is the disposal of waste in unpermitted areas. Vacant lots, alleys, street corners, and neighborhood sidewalks are common sites for this act.
One of the dumpers had said that it's cheaper for them to unload here than to pay to actually dump.
If it's certain toxins that they're dumping, those toxins could go into the ground. And yeah, you can remove the items, but whatever is there is seeping in the ground, especially if it's near our sewer systems and our waterways. So, you know, it can do a lot of effects overall from mentally, wellness, and health-wise.
One issue residents deal with is the social conditioning a neighborhood undergoes in the aftermath of a neglected dumping site.
The dumping gets picked up and immediately replaced. So did they clean it up? Is it clean? No. Did they put resources into going and getting it? Hopefully.
One thing I could say about this neighborhood is there's a lot of people who put in 311 requests to get the trash removed, and we do get good response from 311 and from the streets department. But it's just like it's a constant thing.
Philly 311 is the city site and mobile app where you can submit a form to have dumping removed. But Russell Zerbo says he has learned a lot in his experience with filling out requests.
Vacant lot reports take a lot longer. There's a really long list of vacant lots that need to be cleaned in the city, and it costs about $1,000 for the city to do one of those cleanings. So they kind of take their time in doing it. But if you report something as being on the street or sidewalk, it's a totally different list. It's way more urgent. If there is a shred of a dumping on a street or sidewalk, report it as the street or sidewalk. Don't report it as a vacant lot.
As the trash continues to pile up, Philadelphians are calling for elected officials to intervene and offer them solutions.
Not enough elected officials care about it for it to be an issue in the city.
In more affluent communities, it's easier to be together. It's easier to coordinate reports. You have more of an ear to your elected official, and it's a lot harder to do that organizing in communities that are already disenfranchised.
So there should be more of that incentive that, you know, if you bring your garbage, you get maybe a discount off your taxes, or you get, you know, $10 for 10 pounds or however thing, like some kind of initiative to keep your neighborhood clean.
That's all contracting trash related to all of this development.
When illegal dumping occurs, the assumption is the residents are at fault. but there has been another offender.
We didn't see this dumping until this development booms happened here.
These developers come in, they get the house for cheap, they don't know the neighborhood, and their whole thing is to cut costs at all. What they do is they scout the area, they find a lot, and they dump it.
This is your development site, this is your demolition site, you take care of it. You know, you make sure the trash is taken away, or you clean out the trash that's in front of you. They don't care because they're coming in and cashing out.
For Cynthia Barnes, she believes a proactive approach can help clean the streets of her neighborhood and others, regardless of who the perpetrators are.
It's a two-sided coin where the togetherness is that everybody wants to get rid of it, but does everybody report it? You know, we do have some that are reporting it and some who are probably contributing to it.
For PhillyCAM Voices, this has been Mitty Alonso.
Mothers protest in front of Philadelphia's Department of Human Services. They demand that their children not be separated from their families. Chantel Belafonte takes a look at this painful issue.
Over the years, the Philadelphia Department of Human Services, DHS, has been criticized for separating families. In a report by the Federal Adoption and Foster Care Analysis and Reporting System data, Philadelphia was named the highest city outside of New York to separate children from their families. On January 27th, the group the Philadelphia Housing Action and Families Are Important to Heal, or FAITH, called for end to family separation after a newborn was taken from her mother's arms in the hospital. The Faith organization held a rally in support of the mother in front of the DHS building on 15th and Arch Street. Jennifer Benich, a member of Faith, joined the rally in an effort to raise awareness of family separation. Benich also experienced losing a son to the system.
Yeah, I actually got my son back. The DHS kept making up false reports about my house, no matter what.
Benich said she was able to get her son back when she became pregnant with her daughter. She claims DHS was forced to reevaluate her living conditions after she gave birth. Benich has been strongly involved with Faith, hoping to help mothers like herself.
We're all parents who have been affected by DHS, so some of us, like myself, have already gotten our kids back and are helping mothers who are going through what we went through before, and some of us are mothers whose children are still in DHS, whose children were recently taken. So it's just a mix of parents who either have been harmed by DHS or parents whose kids are still in DHS and who are still fighting to get them out.
Heather Kiefer, Chief of Communications and Strategies for the City of Philadelphia Office of Children and Families, provided us with a statement. It reads, "Where possible, DHS is committed to making every effort to reduce the number of families that formally come into the child welfare system. One of the ways it is doing this is through its diversion services that work to prevent families from becoming court-involved in the child welfare system. Examples of services include family empowerment services and rapid service response. DHS works toward reunifying the family by working alongside the parents to ensure that the court-ordered action items are met. Examples of this include parenting classes, finding housing, connection to behavioral health care, to name a few. During this time, the court may approve parental visits as well, and overnight visits as families come closer to reunification. In addition to the case management team, there is a parent attorney, child attorney, and city solicitor involved." In the statement, Kiefer goes on to say that DHS offers programs to parents who are in need of assistance prior to making the decision to remove a child from the home. In the fiscal year 21, quarter one, there were 1,111 families referred to DHS Division's program. Family empowerment programs continue to receive the most referrals, which is 76%. Benich says protests and formulating committees on child separation is what the Faith organization is focusing on.
Trying a lot of just grassroots organizing, protesting. A lot of the moms had a lot of input and stuff over like David O and the resolution in city council to start like a committee on child separation, which has been started now. So a lot of the moms in the organization are actually on that committee, and there's going to be like hearings and stuff like that to kind of try to see what needs to happen to change things.
In 2019, according to the Federal Adoption and Foster Care Analysis and Reporting System data, the number of children in the DHS care skyrocketed from 4,200 to 6,000. The Kenney administration lowered that number to about 5,000 cases by early October. The DHS goal is to reunify families as soon as it is safe to do so, but the hope is that through prevention services like those described, DHS can support families to safely care for children without becoming involved. I'm Chantal Belafonte, reporting for PhillyCAM Voices.
Pet adoptions have skyrocketed during the pandemic. People have been forced to work from home, and as Connie Combe reports, many needed a furry friend for comfort.
News articles from around the country are reporting that pet adoptions have increased during the pandemic. I interviewed Linda Torelli, the marketing director of the Brandywine SPCA. I asked Linda if she's seen an increase in adoptions during this pandemic.
We have been really blown away by the increase in adoptions. It's been really moving to see the families come in. In 2020 compared to 2019, our adoptions were up 18%. That's a lot of animals getting homes. One of the things that's been great about the increase in adoptions is we've been able to help even more of those at-risk animals. But we've also heeded the call to help out in Texas, where the cold snap is really hurting those shelters. So we're going to take in another 100 animals. We have over 200 animals coming into our shelter in 2 days this weekend.
Sergio Gagliano adopted a dog recently. Cooper Kidd adopted a pair of hamsters. Here are the reasons Sergio chose to adopt a dog during the pandemic.
Well, I've been kind of in search for a life partner for a while. I live alone, and I've lived alone for the last 3 years. And so I wanted a companion. And I was looking into adoption before the pandemic, actually. And when everything started closing down and we started working from home, I kind of took it as a sign to maybe not do that and sort of just wait. Because at that time, we really didn't know what was going to happen. It really felt like the world was ending. And so, you know, as time went on, I saw a bunch of other people adopting anyway. You know, the year passed and I said, well, wait a minute. I've been wanting to do this for years and nothing's stopping me right now. We've kind of gotten used to this stay-at-home life. And so I figured I'd make the most of it.
Cooper explained her reasons for adopting hamsters.
Sure. So I chose to adopt pets during the pandemic because I used to live with a dog and then I moved and I was no longer living with a dog and I don't have the capacity to own a dog at this point. So I thought a hamster might be like a better alternative. I think also I've just been bored during the pandemic and figured that a hamster would be a good addition. So this is Zumi and this is Quarantini. Well, I moved in with my parents during the pandemic. My parents are allergic to cats and didn't want a dog, so I figured a fish or a hamster. And a hamster seemed like the better of the two. Like it actually, you know, moved around, you could touch it. Yeah, I wanted a pet that I could play with and that would play with me. I've also owned hamsters before, so they were, you know, I had experience, so it wasn't just like completely brand new. I wasn't anticipating getting 2 hamsters, but here we are.
This is Linda's advice on preparing your pets for after the pandemic when you resume work, school, and social functions.
It's going to be a big change for the pets when their pet parents go back to work, go back to school. One thing we're really encouraging folks to think about is plan ahead of time on your regular routines. The biggest risk really is what we call separation anxiety. And that's where your pet gets really anxious when you're gone or when you're leaving. And so we recommend thinking ahead about what's your schedule going to be. You know, get your animal out on those regular walks. Also introduce what we call enrichment items. So these could be toys that your cat can play with on their own. Could be Kong toys for your dogs. These are things that you leave with your pet only when you're gone, and it becomes a treat, and it helps focus them away from you not being in the area. So these are all things folks can do ahead of time to start to prepare for that change.
This is Connie Com for PhillyCAM Voices.
Vaccines are now underway to fight against COVID-19, but some are still reluctant to get the vaccine. Bettina Escoriza talked with Dr. Daphne Owen, Assistant Medical Director of Puentes de Salud, about those fears and more.
Hello, everyone. Today we have Daphne Owen, the Assistant Medical Director at Puentes de Salud. Hi, Daphne. Thank you for joining us today.
Hi, thanks so much for having me.
Could we begin with a brief introduction on Puentes de Salud and the work that you do there?
Sure. So again, my name is Daphne Owen. I'm an emergency medicine physician here in Philly, and I volunteer at Puentes de Salud, where I've been for the last 10 years, and I am the assistant medical director there. So Puentes de Salud is a nonprofit health and wellness center here in South Philadelphia that provides healthcare and social services to mostly Spanish-speaking uninsured patients who live in South Philly.
So we're beginning the vaccine rollout here in Philadelphia, and there is a lot of mistrust surrounding the vaccine. And this is especially true amongst communities of color. Now, part of what's fueling the mistrust around the vaccine is the numerous conspiracy theories that started to become really prevalent since the beginning of the pandemic. But there's also a lot of concerns surrounding the fact that the vaccine was developed very quickly, and there is a sort of general lack of understanding around the scientific developments that allowed for the development of the mRNA vaccine. Could you talk to us a little bit about the vaccine, explain to us how it works, explain to us how it's different?
Sure. So this is a new kind of vaccine, an mRNA vaccine. However, it's not brand new. The concept for the mRNA vaccine has been around for a number of years, and actually some of the work was done to develop mRNA vaccines initially here in Philadelphia at the University of Pennsylvania. And so this work has been done for a couple of years, and there was actually vaccines, mRNA-specific vaccines created for the flu, as well as rabies, and a couple of other infectious diseases several years ago. They just never really took off because the demand wasn't there. And so when it came to COVID, for the first time in many, many years, there was a huge amount of money, resources from the government and private business to develop a vaccine safely and quickly. And so this mRNA technology was used for the first time on a mass scale, but again, it had been around, used, tested in the past. So the two vaccines that we currently have approved, the Pfizer and the Mrna Vaccines, are both mRNA vaccines. And what's very important to understand is that both of these vaccines use a piece of mRNA, or a small type of DNA, from the COVID virus, but it does not contain the COVID virus in whole. It does not contain live COVID virus. And so it's impossible to actually get a COVID infection from the vaccine itself. And basically what this technology does is the COVID virus has a spike protein, which you may have heard of, and the vaccine shows your body a little bit of this spike protein so that your body will recognize that if it sees it in the future and attack it. And the really good news about the vaccine is, while it was developed faster than we've ever developed a vaccine. Like I said, it relies on technology that's been around for, a couple of years, been tested before, and no steps were skipped. So this vaccine has gone through the same kind of testing and trials that are done for every other vaccine and medicine that we have. Just that the steps were done in tandem at the same time rather than one after another after another. And so I agree, this was done quickly, and that's something that's new for us and something that can seem scary, but it's important to remember that no steps were skipped, and that this vaccine has been developed and tested under the same kinds of careful watch from the FDA and the government that exists for other vaccines.
That's really comforting. It's interesting too when you talk about the timeline being sped up because steps were happening concurrently, right?
Mm-hmm.
So that I feel like that's really important. Then the big question is, I feel like you've addressed this already, but the question is whether or not the vaccines are safe, and it sounds to me like they are, right? So people can sort of how I don't know, how do you convince people that that this is safe, right? That they should get that
Right.
it's the right thing to get this vaccine.
Right. And I want to say that I think, having some hesitancy or concern is totally normal because this is a scary time. None of us have been through a pandemic before. There's so much that's changed in our lives. And so I think wanting to know about the vaccine and wanting to be reassured about it is a normal thing. And so I think everybody should do their research, and I'm happy to help however I can here. So as far as safety of the vaccine, there's a couple of things that I think are helpful to know for the general public. So the first is that, as I said, the vaccines, both the Pfizer and Moderna, have gone through rigorous testing that's been, overseen by the FDA, where more than 40,000 people have received the vaccines and be closely studied. At this point, in addition, after those studies, more than 10 million people in the United States have now gotten their vaccines, like me. And so I think that's another reassuring thing is that, not only do we already have 40,000 people who are in the trial, but we have now millions who've received the vaccine and, done well. So to go into a little bit more specifics about what we know, in the 40,000 or so people who were involved in the trials, we know that the vaccine, both Pfizer and Moderna, were effective. So nobody who received the actual vaccine became very sick with COVID requiring hospitalization, and nobody who got the vaccine died from COVID. And that's huge, right? Because at this point that we've had more than 500,000 people in this country die from COVID, to have that kind of protection, 94% effectiveness, is really, really great. The other important thing is that there were no serious bad outcomes in the people who received the vaccine. We know that there's some reports of people having allergic reactions. These are things that are easy to be treated and why people are watched after they get the vaccine. But nobody died from getting the vaccine. Nobody had any serious kinds of side effects that, impacted their life in an important way. And so I think that's really important to know from the study, that we see in these 40,000 people, the vaccine worked well and it was safe. And now kind of looking into where we are in a larger sense in the country, where millions of people have gotten the vaccines, we don't have any evidence that there's been deaths resulting from the vaccine or any other kinds of serious outcomes. And again, that's really important when we know that, 500,000 people have died from COVID and nobody's died from the vaccine. So I think that should help to be reassuring that this is a safe vaccine and one that is going to work to help protect us from how bad we know that COVID is.
So what kind of side effects can people expect from the vaccine?
That's a great question. So the most common side effect that we see after the vaccine is some achiness, muscle pains, even fever, and just feeling a little bit sick, usually for only about a day or so. It seems to be that people have those reactions more commonly after the second than after the first dose. And again, it's impossible to get COVID from the vaccine itself. So having a fever or some muscle aches after the vaccine actually just kind of tells you that your body's responding to the vaccine and that it's working, rather than, that you're getting sick from the vaccine itself, getting a COVID infection, because that's impossible. Some people have no reactions or side effects at all. And again, the most common ones are fatigue, fever, muscle ache, headache, things like that. Again, short-lived, typically less than 24 hours.
Where can Philadelphians access the vaccine? What does the vaccine rollout look like here in our city?
That's a good question. So vaccine rollout in the United States is being done on a local level. So each state and county has its own way that it's distributing the vaccine. That means that each state and county doing its own process can be a little bit slow, and each one has its own different regulations and rules about who qualifies when. At this point, Philadelphia is distributing vaccines at a number of different locations, and the city on their public health website has information on all of the locations where one can currently get a vaccine and who is eligible. At this point, people who are 65 years and older are eligible to get a vaccine, or people who work in some high-risk kinds of professions, like in the restaurant industry, in education, public transportation, or other kinds of situations where they have a lot of, face-to-face interaction with other people. There is a number of efforts going on right now that have been really successful. The Black Doctors Consortium has been doing vaccine events at a number of different locations throughout the city. The Department of Public Health is also doing their own vaccines, and some smaller clinics and pharmacies are doing vaccines as well. So the best thing to do is go to the Philadelphia Department of Public Health website and check there for the most up-to-date information about who qualifies at this point in time and where you can go to get a vaccine. You also can sign up on the city website to be on an interest list or wait list to be contacted when potentially it's your time and the city can offer you a vaccine.
Great. Then the other question that I have, this maybe is a little bit more esoteric, projecting into the future a bit, but I know that part of the vaccination process is that once we have enough people, a certain percentage of people vaccinated, we do reach that point of herd immunity, and we're hopefully expecting for life to go in quotes like back to normal in some way. And I'm wondering what the timeline for that is, and then also what kind of obstacles we're facing that are keeping us from achieving this herd immunity.
Those are great questions. I think that at this point in time, it's hard to say for sure when we're going to go back to normal, but as you said, a lot of it depends on how quickly we can get a large portion of the country immunized against COVID. Many experts at this point think that sometime by the middle or end of the summer, Americans, anybody living in the United States who wants a vaccine will have had the opportunity to get one. And hopefully that means that before the end of 2021, we can start to have reached the point where enough people have gotten the vaccine that we have what's called herd immunity, and it's not easy for the vaccine to spread and infect people because so many people are now immune. So I'm hopeful that next we can celebrate going into 2022 back to normal, and potentially even sooner if we can, do a good job of rolling out the vaccine to everybody who wants and needs it. And I think that this is going to require a couple of different kinds of efforts. Large vaccination events are going to be important to get people vaccinated, but also there's groups that are a little bit harder to reach or may find it difficult to get to those kinds of venues. And so there's also efforts to reach into more vulnerable communities or harder to reach communities, and even go door to door or to meet people where they're at and try to offer the vaccine in a way that's accessible to everybody.
Thank you so much, Daphne, for all the valuable information that you gave us today. I think there's still a lot of questions, but I feel like we've addressed a lot of them here, and our audience will find it very helpful. Thanks a lot.
Absolutely. And I think I'll say, for myself, as I said, I'm a physician. I I work in the emergency room outside of my work at Prentice. And, I think what I'll tell people from my own experience is that I've really seen how devastating COVID can be. I've taken care of people my own age with COVID who died in front of me from the infection, and just seeing how terrible it can be to families. And I, also felt a little bit hesitant about the vaccine in the beginning, and really did my research, and for myself realized that it was something that I could do, to get the vaccine. Not only was it safe and effective, but by getting it myself, I could not only protect me and my family, who I come home to every day, but also the patients that I take care of, my community, and that maybe by people like me getting the vaccine, we can move back towards normalcy, and get out of a lot of the really challenging economic problems that have come along with COVID. So many people in Philadelphia, and especially in minority communities, have really suffered as a result of the economic consequences of this. And so, getting vaccinated to me is not just about protecting my health, but also about trying to help our community get back to where we all want to be.
Thank you for watching. You can actually watch us also on YouTube and Roku, and follow us on Facebook and Instagram. We'll see you next time.